Hello. So as we've seen, Betsy has moved from facility to facility during this episode of care. She has multiple chronic conditions, and it's critical that each care provider has complete, accurate information at the point of care. But we also need to keep Betsy and her family engaged in her care and informed of her current status. At any point in her journey, Betsy can access the current copy of her clinical data. This helps Betsy engage in her care, provides any answers, details that she may have missed during her discharge meetings, and provides the opportunity to formulate any questions she may have. So here we see Betsy's ability to access her data. We'll start with her demographics section. And I'd like to point out that she has 2 adult children. One, her son Charles, is not only her son, but also her emergency contact and guardian. And she also has an adult daughter, Deborah, who, while she lives in a different part of the country, is just as interested in engaging in her mother's care and supporting her mother through her health journey. We also have contact numbers for each of these people. We also show the complete medication list for Betsy, as well as her list of conditions. We'll notice that Betsy has multiple chronic conditions, which makes her a little bit more challenging when she needs a little bit extra care. And you'll see us address this as we move forward. The next 3 points in her conditions are her assessed needs. This came out of the eLTSS plan, which we'll be talking about next. So I'm going to jump down to the eLTSS care plan. And this is the primary plan. You can see that she has the beginning date and the end date of this particular plan and a description of specifically what it's trying to cover. We know who the author is, Mark Planner, and his contact information, and also the funding source for this particular effort. We notice that Betsy has 2 strengths. She's able to manage her own bills, and she also can walk independently with a cane. As part of the planning process, Mark has asked her about her preferences, and she's actually very happy with her current service provider and would like to continue receiving services from this particular organization. The next section represents Betsy's personal goals. And in this case, she'd like to improve her balance skills, and she would really like to dance at her son's upcoming wedding. So the plan for each of these is she'll be performing more exercises to improve those skills, and she'll be working on her mobility to dance at her son's wedding. Additionally, this plan addresses the following needs. She needs transportation from time to time. She also needs some nutrition education to address her diabetes, and she needs some treatment for her depression. The next section describes some of the activities related to those particular needs. And for each of these, we have the description of the activity, both the start date and end date, the frequency that they're delivered, and if there's any cost related to it, all of that is detailed here. Additionally, we know who's responsible for providing each activity and their contact information. A couple things to point out in this first activity. This is represents a self-directed activity. So Betsy herself realized that sometimes she lacks balance in the tub. And so she realizes that she needs a railing installed, and she's actually gone out and engaged her son Charles, who has agreed to install this on her behalf. In the next section, where we have this non-emergency transportation, there's a comment where the service provider will provide a reminder on the business day before the trip and will call when they're on their way. The next section is again part of the eLTSS plan and represents the fact that we need a signature for each of the roles of each of these people providing care and their contact information. Had this been actual data, there'd be an actual signature provided as well. We also have risk assessments associated with Betsy. So she is at risk for falls and also for depressive disorder. And again, we have the risk management plan associated with these risks. The last section represents a questionnaire, and it's part of the eLTSS plan to validate her involvement in the plan and support of the services that are being provided. I'm going to jump over now to the assessments. I'm actually going to fast forward so that we can show the assessments done through all of our use cases had we actually demonstrated each one of these during our demonstration. So for each of these, for most of these assessments, we can see that they're performed twice. So we're doing a functional status assessment, both on admission and discharge at the hospital. again, admission and discharge at the SNF, and again, the admission and discharge at the Home Health Services Organization. If we drill down to any one of these assessments, you can see for the mobility assessment, there were 17 different questions. So we have the specific question and the answer at that point in time for each of these. And of course, we can drill down to any one of those. Additionally, we're providing a summary where you can see how each individual question was answered over time, and you can verify that and evaluate that at that granular level. In this particular case, we're also showing a trend, and we can see that our patient Betsy has actually improved over time on this particular question. This helps the person providing subsequent care to better understand where she was and how she has moved on through her treatment of care. This is the same sort of situation for each one of these. This is the self-care assessment. And again, we provide the summary of how she's done over time on that particular assessment. The same for the IADL, and again, the summary for each one of these. This is the independent living section. In her cognitive status, again, you have the drill down and also the summary information over time. And this is the same sort of information for the BIMS, PHQ-9, and MOCA. For each of these, we also have a top level score, and that's provided at this top level information. All right. So that basically is a summary of the patient accessing her own data, but we also noted that Betsy has a son, Charles, who's involved in providing support to his mother. Both Betsy and Charles want to be updated on Betsy's current medical status. So the PatientShare system includes the ability for Betsy to easily share her medical record with users of her choice. Betsy has created electronic consent, which allows her son to have full access. So demonstrating that, this is a series of consents which Betsy has created for sharing her medical data. We'll edit one of these, and this is the case of her sharing her data with her son, Charles. She can choose to share all of her data as she's done here, or she could choose to share just a subset of that data. That's her option, but we'll continue to share all. There's also, it defaults to a term for her consent, but she can make this longer or shorter or adjust it as she wishes. She also can revoke that sharing at any point in time. Again, she's created consents for other people as well. In this case, she's given her daughter, Deborah, access to her data. And she also has another physician outside of this particular transitions of care use case that she'd like to share her clinical data with. And this gives her the ability to do that. So for any of the people that she shared data, and let's talk about her son, Charles, it will allow Charles to log in as himself and have secure access to Betsy's most current medical data at any point in time. So we'd also like to point out that the PatientShare Data Hub that we demonstrated today includes a read-write FHIR API endpoint. At the start of our scenario, Betsy's current medical status is written to the Data Hub. As she transitions through each point of care, her most complete medical record can be reviewed by each care provider. At each point, our clinician can update her medical record to reflect any changes or additions. This demonstrates the patient record traveling with the patient so that the most complete medical record is always available where the patient is receiving care. We should also notice that this track has demonstrated the FHIR API used in a read-write use case, enabling dynamic, seamless data exchange across care providers. This will enable better care for our patient with multiple chronic issues. At the same time, this will reduce provider burden in sharing data while engaging both the patient and their family in improving the patient's health. Thank you.